Vasovagal syncope, physical therapy as a treatment. Today's treatment options for vasovagal syncope are limited and ineffective. These treatments include increasing water and sodium intake as well as prescribing drugs which do not decrease symptoms. Throughout this presentation, we will be exploring how physical therapy can be implemented as a treatment method for these patients, as well as myths about this disorder and why current treatment options simply are not enough. So what is vasovagal syncope? Vasovagal syncope is described as a sudden loss of consciousness followed by an almost immediate and full recovery. Vasovagal syncope is also known as the simple faint. This occurs due to a large fluctuation of blood pressure. Vasovagal syncope breakdown. Vasovagal syncope has two prominent phases: presyncope, or the symptoms one experiences before a faint, and syncope, the faint itself. Symptoms shown during the presyncopal phase include dizziness, tunnel vision, nausea, and more. Have you ever gotten up too fast from a seated position and felt dizzy or lost your vision a bit? You have felt presyncopal symptoms. Vasovagal syncope accounts for over 50% of the recorded fainting incidents. However, treatment options still remain dismal. Introduction. In recent research, positive outcomes are seen in patients who go to physical therapy and perform body conditioning exercises. Physical therapy as a treatment for VSS could eliminate harmful side effects of prescription drugs and provide a higher quality of life than being told to increase sodium intake. Myths about VSS. Vasovagal syncope is not caused by overexertion. This thought keeps physicians from recommending physical therapy as a treatment. However, since this is false, patients can safely be treated by physical therapists. Also, it is a myth that increased water consumption can prevent syncope. There is actually no correlation between the amount of water consumed and the likelihood of a fainting spell. Physical training. Physical training can be beneficial to patients with VSS. The physical therapist would work with the patient to increase orthostatic tolerance. Physical training can also help to stabilize blood pressure, reducing the risk of a faint. Physical counterpressure maneuvers. This method of treatment can be introduced by a physical therapist but should be used by a patient throughout their daily life. These methods are meant to keep blood flowing even during a stationary position. Examples of PCM include crossing legs, clenching fists, and squeezing legs. Compression methods. Compression methods aim to prevent blood from pooling or staying still in one area of the body. Blood pooling can be harmful for VSS patients because when blood moves from the pooled area, it creates a drastic drop of blood pressure that may result in a syncope event. It has been found that patients who utilize compression mechanisms are less likely to experience syncope events than patients who do not. Yoga as an alternative. Yoga has been examined as a beneficial exercise for VSS patients. Yoga focuses on breathing exercises and physical posture, which can help to regulate blood pressure and in turn benefit syncope patients. Patients who practice yoga saw a positive and drastic change as it relates to the stability of their blood pressure. Risks if VSS is untreated. If syncope goes untreated, the risk for heart disease and stroke increase for patients with VSS. These patients, if left untreated, face a higher mortality rate than those without vasovagal syncope. Conclusions. In conclusion, physical therapy has shown to benefit vasovagal syncope patients and even prevent syncope events. Physical therapists can use a variety of techniques and methods to most adequately assist the patient. All of the methods discussed work to stabilize blood pressure and reduce the large fluctuation of blood pressure, which leads to syncope events. Physical therapy, while it may not stop all vasovagal syncope faints, helps to stabilize blood pressure and increase the longevity and quality of life for patients with VSS.
Created using Powtoon.